Let's get close, but not so close. Share from a distance. Now we want to see each other. We'll have to stay in your time space while we talk.
Welcome to episode 28 of Quarantine. We're about to turn 30. This is around 3 months or so since this entire affair started. And if you've been following us, you know the arc of these conversations began when COVID sent us all indoors. We were disconnected, and yet it seemed there was a jump in innovation, a kind of a restless organizing to both deal with how would one quarantine, how would the innovation community collaborate and work together? Was this an increase in the urgent work to be done? And since this all started, it seems there's been an acceleration on many fronts. There has been an acceleration in the urgency of the conversation around health. The economic conversation has been supercharged because of the economic crisis and therefore the policy responses. America's racial woes get supercharged. So suddenly what we have to deal with is so plain. And also how we deal with it is apparent. You know, it's increasingly clear that especially in a complex problem like COVID in this country, it's dealt with locally in addition to nationally. And it got us to thinking that in a way, what we fetishized in this show or focused on was all of this immediate response. And this is something Americans are good at, right? Though Tocqueville noticed that there's a problem here, we form associations. And I think that's the innovation community we celebrate. And yet there are certain things that take a very long time. And if you zoom back, they actually frame as a real problem. And if you think about health in this country, we as Americans seem very excited about going and solving a problem after it happens, but we haven't been particularly good at thinking through how do we prepare ourselves for there to be less of it, less of a problem. And that's what today's show is on. It's really looking at population health and the bigger picture of how we become a healthier community. Last week we talked a lot about how we could build a wellness and flourishing into cities, but it's a fact that nearly 20% of the US GDP is taken up with healthcare, and we don't do it particularly well. 42% of us are obese. And so perhaps we should be thinking less about fixing things and more about what if the framework of approaching health and wellness was just part of how we looked at things. It seems like an important framing. And that's what we're going to focus on today with a couple of folks who really can help us look about that. I'm excited about this because anytime you have a conversation that helps you look at things differently, what a great way to head into the weekend or into, an election year or a year of thinking about things. We're going to have Ellen Betchord, who has been a great policy person and health clinician at the University of Pittsburgh Medical Center, and Steve Downs, who's a top innovator, is now with the Robert Wood Johnson Foundation, or perhaps he was formerly chief strategy officer there, but now runs a great innovation group. And we're going to learn a lot. Mickey, hello.
Hey, Peter.
Got it.
Thanks.
Back up. There you are.
Uh-oh.
You had your volume.
Am I there?
Right? Yes.
Good to see you. I'm super excited about this episode because one person I've really never talked to beyond just prepping for the show, Steve, and then the other person I've known for years just as a fan and a friend, and just really am excited. So I'm super excited for Ellen to be joining us. She has a really deep history in kind of understanding at both the population level, but actually at the very specific level, how people move through life, how they find well-being, how they find the strength and the grace to kind of move forward. And so this topic feels really important. I just wanted to point out, in the last week or two, we've seen announcements from Amazon, rolling out pilots of Amazon Care just to their employees, but kind of a reimagining of care from a very large tech company. We've also seen at the big Apple conference on Monday, the launch of more features of different ways of thinking about healthy sleeping, and things that can detect it. Eric Topol, down at the Scripps Translational Lab, has pointed out that they're starting to discover signals in your heartbeat and breathing that seem to pre-signal symptoms of having an infection, maybe a few days, a few hours, et cetera, ahead of time. So there's some really interesting work there, as well as a hand washing app for your iPhone, for your iWatch, I guess, just to make sure you wash your hands for 20 minutes. Or 20 seconds. If I've been doing it for 20 minutes, maybe that's why my hands feel really bad. But in any event, there's a lot going on here, but it almost feels like every single thing is about either motivating us to be healthier, trying to teach us to be a better, steward of our own health. And I think those are all fine. But it almost feels like everything we're pushing against is pushing against us pretty hard. And how has COVID and these collection of epidemics, the epidemic of structured racism, and the epidemic of police brutality, and the epidemic of COVID, and sort of the challenges of having a kind of coordinated scientific conversation and response, it feels like there's also this feeling that it's really hard to be healthy. And why is it so hard to just live a healthy life? Why can't we just be healthy in the act of being us? And kind of tune ourselves and be tuned, and have the environment, the products, the services, the places, the policies all kind of shape that. And so I'd love to just bring both of our guests on, Ellen and Steve. So we'll just have you all both come on. Maybe just introduce yourselves, just a little bit about yourself, and then we'll jump into the conversation. Steve.
Oh, okay. Hi. Great to be here. I'm Steve Downs. As Peter said, I'm formerly with Robert Wood Johnson Foundation. I spent a long part of my career there, which is a major health philanthropy focused on health in the United States. And I'm now the co-founder with my friend Thomas Getz of a project called Building H, which is about building health into everyday life. And I'm really looking forward to talking about sort of why we need to do that, and what that's going to look like.
Ellen, so good to see you.
Hi, good to see you too. I'm Ellen Beckjord. I'm the Associate Vice President of Population Health at UPMC Health Plan, clinical psychologist by training with additional training in epidemiology, consumer health informatics. I've been fortunate to be working in health or healthcare for a long time at Rand Corporation, the National Cancer Institute, most recently at UPMC. Population health is literally my favorite topic. So, and I'm so excited about Building H. So as Steve knows, he's knows that I've been watching really closely, and just so I'm thrilled to be here on quarantine and to get a chance to talk with all of you.
Yeah, thanks for joining us. All right, so actually I want to zoom in on Steve for a little bit, and can you tell us, to set this up, what is Building H, and maybe how did you get here? Like a little bit maybe about yourself, and then what is this thing?
Sure. Yeah. So it depends how far back you want to go, but I've always been one of these people that even as a young kid was really excited by technology and the promise of technology, and sort of, as I kind of grew up a little bit, also really was interested in sort of social impact and social good. And I wound up through a sequence of events getting into the health field, and was particularly interested in things like health IT, and spent a lot of time looking at things like how do you use health or IT in the clinical settings, so things like electronic medical records, and then got more and more interested in actually how you use tech to help people try to stay healthy. And so there were a lot of programs around how you maybe track your own data and use data for decision making. And the more I sort of looked at it, and the more I looked at kind of the way the trends were, the more I started to think about sort of what it actually means to be healthy, and sort of what gets in the way of that. One of the things I is really sort of stunning to me is to look at the rise in chronic conditions in the country over the last 5-6 decades. And I know we have a few slides on that in terms of things like diabetes, which has gone from 1% of Americans in 1960 to around 10% right now. Peter mentioned obesity. It's at 42% of American adults. Used to be, back in like 1960, it was 14%. And actually, severe obesity, which is a whole other level, that was about 1% in 1960. It's now 9%. And it's actually projected to go to 24% by the end of the decade. And if you just sort of look at some of those slides, wow. They may be a little hard to read, but the idea is think about something that's just been growing steadily for 50, 60 years. That's severe obesity. It's going up 5.5% each year over the last 5 years. And as Peter said, we like to jump in and fix things that are acute. But this is really sort of a slow rolling problem, right? And actually what, a lot of these conditions are in effect sort of behavior related. And I think one of the things that we've learned over the years is that behaviors, are some element of free will, but they're also very easily shaped and manipulated. I think the whole field of behavioral economics shows us that. And as I was looking at all of this and looking at sort of the role of technology in kind of shaping our lives, I drew that very simple conclusion, which is that it's become hard to be healthy. And it sounds kind of flip, kind of simplistic. But I guess what I'm getting at is that when the numbers for chronic disease are as high as they are, it's sort of no longer a question of everybody's just needs to try harder. Clearly there are challenges that we're not grappling with. And so the metaphor that I've often used in describing this is that it's like in order to try to stay healthy, it's like we're all swimming upstream. We're swimming upstream against a river whose currents are getting stronger. And it's the currents of sort of cheap processed food that's available to us. It's a car-centric transportation culture. It's longer and longer commute times each year. It's work days that now seemingly have no boundaries anymore. And then I would add on top of that sort of bottomless bowls of Facebook and Netflix. There's always something to keep us up. So you look at that and you say, okay, so it's hard to be healthy. We're all swimming upstream, but I think most of the innovations that we see these days, particularly tech innovations, take the form of trying to help people become better swimmers. So we work on people's motivation, or we try to provide better information and feedback to help people make decisions. Or maybe it's educating people and sort of giving people more understanding of the health consequences of different behaviors. But the numbers would say it's not working. Or it's working at the margins. It's working for some people. And I don't want to suggest that we shouldn't be doing all those things. I think it's critical to keep doing those things. But I also think we have to ask ourselves a different question. And that question is, what would it look like to reverse the direction of the river? So maybe I should pause there in case there are questions or reactions.
Yeah, well, actually,
I can keep going.
I love that frame. No, I love that frame. And I think this notion, it's just very visceral. Because even I guess have been assuming that there's the motivation side of things. Like, am I motivated? Do I feel like even getting up today? Do I feel like getting outside? Or if I'm a little heavy, am I motivated to lose weight or something like that? And I've often heard the description between this kind of gap between motivation and behavior is actually a pretty deep gap. And people just trying to market to you or tell you, fad diet of the week, whatever. It doesn't actually change it. A lot of people are motivated that they'd like to be healthier. They write, their resolutions at the beginning of every year, and then they break them within the first month. And the motivation and behavior gap seems like a big one. But I guess when we talked, it felt like, wow, that's just trying to make people healthier swimmers. Can you actually build have healthier habits into this? And it didn't hit me that, wow, what if the entire system is sort of not only pushing against us, but it's actually getting more, like the flow of that torrent is getting harder. And this pandemic seems to have triggered it. Can you talk a little bit more about like, how does this shape of the way that we deal with wellness and living a healthy life. How is it particularly exacerbated by the pandemic, by what's happening?
Yeah, no, I think there are a couple perspectives on that. I mean, one is that sort of tragically, the pandemic, or I would say the virus it's sort of, if somebody had engineered it, they engineered it brilliantly to take advantage of the vulnerabilities we have in this country. And as I said, tragically, the presence of underlying chronic conditions is one of the biggest risk factors for dying from COVID. I just saw something recently that you're sort of 6 times more likely to be hospitalized and 12 times more likely to die if you have an underlying chronic condition.
Oh, wow.
So I mean, so I think it's really quite serious and as I said, tragic in that regard. I mean, I think that the interesting things around some of the changes is that they sort of work perhaps in both directions. One of the things I've been really interested in is actually the things that make us healthy. And I think they're sort of traditional things that we look at. It's like, oh, it's diet and it's exercise and it's medical care and it's genetics and all of that. But there's more and more work that says it's things like social connection. It's things like actually spending time outdoors. It's things like getting more sleep. And so, some of and of course, everybody's experience is different. In COVID, the difference between, let's say a worker who can work remotely, and not have to commute and stay in their home and be able to spend more time with family is obviously very, very different from, let's say a frontline health worker, a nurse's aide, or somebody who is having to get up early in the morning, take public transportation to get to a hospital and work a long day. So I think that's important to recognize. But for some people, there are really positive changes in the, they're not spending an hour and a half in a car going back and forth to work, and that's time that they're actually spending with family. Obviously, the social aspects of not being able to sort of be present physically with people is hard, is hurtful to a lot of folks. Although again, some people have been creative about being in touch with more people, actually, sort of virtually. So I think it's a mixed bag in that sense. There's more cooking at home, I think, which is a good thing. So it's sort of all over the map on that. I think what's potentially important is it's also a moment where people are perhaps more in touch with sort of what their everyday routine was and what it is now, and perhaps what they would like it to be. And so we'll see some interesting things coming from that.
You had a really interesting Medium article recently where you sort of outlined a little bit of this building H philosophy. And you were at Robert Wood Johnson Foundation for quite a while. You were doing all sorts of interventions, looking for lots of ways to do this at scale at the foundation side. And then you've really decided to try to almost create a movement around how could we live a healthy life? And can you tell us a little more about what you and Thomas came up with this, and why now, and maybe your frame, because you had a very interesting system point of view on it, almost a Donella Meadows kind of leverage idea, and I'd love to hear a little bit more about that.
Sure. So I think that as I mentioned, the whole idea of sort of swimming upstream and asking the question of how could we reverse the direction of the river, and what would that look like? What that really means is re-examining some of the fundamental patterns of how we live our everyday lives. So looking at things like, how do we eat? How do we sleep? How do we get from place to place? What does work look like? How do we socialize? How do we entertain ourselves? I think we take a lot of those things for granted. That's just the way these things work in society. But I think, what we really want to do is challenge sort of the innovation community, challenge whether it's the tech companies, the investors, the people that are really coming up with the new ideas, to say, in addition to Apple Watches and Fitbits and things that will remind us to go to sleep, or things that will tell us how many steps we took, what if you made those things easier to do? So made it easier to just get steps in because that's how our days are structured, or made it easier to fall asleep at night, made it easier to connect with your friends. So so what we're hoping to do is kind of catalyze innovation in that area. The piece that you talked about, the written piece, does come from sort of a systems perspective, which is what this is going to take, I think, and actually it was inspired by a conversation that I had with Tim Brown, the chair of IDEO, the design firm, who said this isn't about somebody drawing up, sort of what the right answer is. This is about sort of massive parallel innovation. But what the key is, I think, is it has to be aligned innovation with some common goals, innovation with some common mental models about how we think about health and producing health. So the piece that I wrote, which is up in Medium, is about sort of 5 shifts in thinking about how we think about health and how we sort of design for health. And I think you have that maybe you could put up, and I could just sort of walk through that.
Yeah, let's put up that graphic, Omid, of the sort of 5, from to. So walk us through this. What step by step?
These are sort of framed as kind of from to shifts, but I don't want to suggest that everything on the left is old news and we shouldn't do it anymore, and everything on the right is all good. I think it's really a question of shifting emphasis. But so again, the first one is about moving from helping people overcome the challenge of being healthy to actually helping reduce the challenge of being healthy, and this is sort of stems straight from that river metaphor. Instead of helping people become better swimmers and sort of overcoming the river, let's reduce the challenge of it. Let's make it easier. Let's lower the barrier. And I think of examples like, cooking dinner is actually kind of a hard thing to do for a lot of folks. There are a lot of steps involved. It's not a simple, easy thing. So instead of sort of driving people towards more sort of fast food, processed food solutions, what if we made it easier to cook dinner? The next is around sort of moving from individual responsibility for choices made, and I guess I mean behavioral choices, to collective responsibility for choices available. And, again, I don't want to suggest that people shouldn't take any responsibility or any control over their own behavior. I mean, of course they should. But I think we have to move from sort of blaming people for what choices they make to really looking at how those choices are influenced and actually the availability of choices. Really from an equity perspective, we know that the choices available to some people are not available to others. They have more money to buy healthy food. They have time and control in their schedule to put in workouts. Maybe they can go for a run in a safe neighborhood, whereas somebody else either can't go for a run in a safe neighborhood, or they get harassed, simply for the color of their skin. So we all have different. Sorry, go ahead.
Is dangerous. The physical environment is. It was a Superfund site that's been converted to Alameda, I guess. It's a place in San Francisco, but these are not necessarily always healthy places to begin with, where the environment itself is kind of we've got plastic water supply at micro levels and food deserts where people have to get into a jitney just to get to a fresh fruit and vegetable, and probably only have a microwave in their house because they just didn't. There was no cultural collective kind of understanding or movement in that way, and this was what they could afford. And
So actually, what I would say is there are multiple environments to consider here, and so one is sort of literally the kind of air and water around us. You think about Flint, Michigan, and lead in the pipes, and so the environment can harm you in that sense. The second is sort of the physical or built environment, and that's things like access to green space and sidewalks and bike lanes and sort of again sort of and public spaces that bring people together and create community. All of those sort of things contribute to health. Noise is another example, sort of in the built or physical environment. There's also, I don't want to undersell the role of the policy environment. It's not what we're focused on particularly, but there are things like sick leave policy and tying health insurance to employment, that really do affect people's health. Sort of the ability to get early childhood care, for example, is another policy and part of the policy environment. The environment we're actually interested in is the product environment, and the products that are on the shelves, the products that are downloadable, the products, that we buy and we wear and we, all of those things. They shape our behaviors. They fundamentally shape our behaviors. And I think that public health often doesn't look as much at that. And that's sort of what we're interested in. And so really trying to encourage companies to think about what are the products that they have, that they offer to people, and how do they shape people's behavior? And do they shape that in a healthy way, or perhaps a less than healthy way? And if it's less than healthy, how could you make it better?
What's fascinating about this is it really is a system issue, because there's so many places you could attack it. I mean, personal, group responsibility, or how you take responsibility for things is probably, especially in a country like the US, where we all have a lot of opinions about liberty and stuff. Like, does that start with early childhood education? Is that a cultural thing about how we're brought up? And then you've got, like, on the product side, we have because we're just a market-based country and we have big food, we have a very big complex that, like sugar and stuff like that, we're not that big on regulation. So this is an amazing prescription, but I'm wondering who fills it.
Yeah, well, there's a question here too. Just I almost feel like I want to make sure I catch the other three. We went through two of those, and then I kind of just derailed a bit. But I want to catch the other three of the from twos, because we kind of got stuck on the responsibility side. But I also think there are some provocative things out there. We've had Ting Jiang from Dan Ariely's lab on as a recurring guest on our show, and she was able to show a fascinating scale that had no numbers on it. And we always think of, if you step on a scale, of course it's going to show you a number, but it actually wouldn't show you a number for a month, because the rolling average was the way that you actually helped people understand, because just water weight and other things would change it. So it would just glow, but it would kind of give you things that were habit forming about just getting comfortable, so you didn't have scale aversion in the first few weeks, so that you actually built it. And they had a 65% increase in sort of a year later, people using it. But you look at a scale, and a product designer would never say, hey, let's get rid of the number, but the thing was, it had to do with the way the brain works about numbers and aversion when you see something that is actually a longer term trend that you react to in a shorter term way. So let's go through the rest of these. And then you mentioned after this, I'd love to actually bring Ellen in, because Ellen is the one who told me all about this, and have her kind of reflect on this as well. So
So just quickly, the idea of shifting from healthy behaviors added on top of every life to healthy behaviors resulting from everyday life, and sort of the idea of, think about like exercise or a workout. A workout is a workaround. A workout is a hack, right? A workout is saying, in doing what I need to do to live, and to sort of go through my day, I don't get enough physical activity, and so I need to run around the block. There's an evolutionary biologist who wrote this wonderful book called The Story of the Human Body. His name is Dan Maberman. He has a rant about this. This is, never in the course of human history has our species voluntarily wasted physical energy. But yet we do that because we don't produce enough of it in our days. So this is about sort of, again, wanting you to live your life for the things that matter, and then health is a byproduct, as opposed to health is something that you have to consciously do as an add-on. The next is from what I call pushing behaviors to pulling behaviors. And if I think about pushing behaviors, that's the nagging, right? The cajoling, it's time to go to bed, you need more steps, you should order the diet soda, or actually don't do that. But to pulling behaviors, which is where you almost induce a behavior by making something attractive or lowering the barrier to that behavior. And I want to give you two really quick examples of that. One is it's a strategy in how do you get people to eat more vegetables. Google is doing this in their dining halls. You make them taste great. You cook them really, really well. It's not about saying, here's a really bad, sort of pile of blanched broccoli, enjoy it. It's about saying, we've made something incredibly delicious and you're going to want it. Elon Musk's strategy with Tesla is very similar. He didn't create a really boring, bad car that was no fun to drive and then tell us we all needed to drive it because it was good for the planet. He did, he created a really great car, and people looked at it and said, I want to drive that car. And the planetary benefit, sort of comes along for the ride. So last one, is the idea that we often think of health as sort of this vertical market, or I think companies often think of health as a vertical market. And I think that's true about healthcare. Healthcare is an industry you can sell to. But health is not an industry. Health is it's an outcome. It's a state of being, and it is affected by virtually every sector. And all sorts of products that you don't think of as being connected to health are influencing health in some way. And so I think the way that has to be expressed is as a horizontal value. And sort of the corollary of that is sort of not just for a company having a line of health products, or these are our good health product, kind of services, but actually embedding health as a value across the full range of products, and saying for each product that affects how a consumer behaves, to ask, is this helping folks stay healthy, or is it making it harder? And what can we do to sort of shift in the direction of making it easier?
And it feels like this idea of a horizontal value, a long time back, I wrote a book that had to do with sort of what happens when we have trillions of computational things, when we're basically living in a sea of information instead of kind of staring at it in our phone or on our tablet or laptop. And one of the things you started seeing was that everything was an accessory to everything else. That these things were not like disconnected products, had to just be themselves. Like this thing that's a thermostat is just a thermostat. But the minute that they're connected, they're actually connected to things that seem like weird. Like, why is that thermostat has a lot to know about, like maybe how many times I happen to wander by it to go to the fridge to get something out at 3 a.m. That washing machine knows if my mom fell down because it's in the laundry room with the toilet on the first floor. And I know that, like, if any, it has a sensor that I can't tap into because it's this vertical silo. But if everything could actually start to kind of be a part of the social network of us, the same way that we would get benefits from, there are some wonderful studies about the social network benefits, or the network effect of being surrounded by other people who eat this way or think this way or do this thing, actually helps you because it's not alone. What if the products were part of our, we're actually almost in some ways collaborating to make life easier, to make life healthier, to sort of say, oh yeah, you know what, I could let you drive this way and you'll go by 5 fast food drive-throughs. But I just noticed that you set a goal that was this. So I'm actually going to take you on a more scenic, interesting route, and you're going to have to end up like it's going to break down, and then you're going to have to go for a walk. You're going to have an adventure with your family, and you'll still get there in the same time. But like, it turns out you're going to actually get the goals you set, not the, not
yeah, I like that. And there's a sort of a quick response to that, which is you can imagine that some of the conversation that gets raised starts to then drift towards the issue of paternalism. And I've definitely talked with companies that say, we don't want to be the company that is sort of advancing the nanny state by deciding, that our users, should do this stuff because it's good for them. And I get that. And I think what we also know is that people's decisions in the moments are not always aligned with what they would wish for themselves if in their sort of more reflective moments. What you desire ahead of time is not necessarily what you actually do in the moment. And sort of the way almost to split the difference is to sort of think about, how do you honor the user's intention? So that example of the sort of, take a healthier route, or perhaps, take a walking route instead of a drive 1.5 miles to the store, is instead of sort of Google saying like, we decided, that the better thing for you to do would be to walk, is to actually understand what the user really wants for themselves, sort of ahead of time. And in general, sort of what are their values? What are their sort of almost, kind of persistent preferences? And then actually sort of the phrase I would use is honor those intentions.
Steve,
sort of help the user.
Where do you see this working particularly well? We've been, we've had quantified self for 10 years. We've got Apple Watches out there, and classically in marketing, there's early adopters who probably can express what they want and use things. But point us to the kinds of things where population changes start to take place. The health version of everybody loving the Elon Musk car.
Yeah, I think that it could take a number of forms. So, I'm starting to see companies that are focused on the problem of how do you make it easier to cook dinner. So like June ovens is an example of something. They're trying to make it sort of almost foolproof to cook. There's a company out there that is trying to become the Spotify for cookbooks. So I think there'll be innovation like that. I think some of it is going to come, from some of the larger companies, making conscious decisions about supporting healthy behavior sort of in their core products. Maybe one day I can dream, Netflix won't, sort of autoplay the next episode after midnight when I'd rather go to sleep, but they know they'll hook me if they start the next episode. So I think you may see some of that. I think there is a one of the key questions is, can companies find spaces where I think the innovation hasn't been done and there is latent demand? So where they can kind of build a subtle change into a product or find a new product that makes it easier for people to do things and do well with that. E-bikes is another good example, right? E-bikes actually lower the barrier to using a bicycle. They make it easier, for people to do the healthy thing. And that's.
I feel like before we go too much further, let's have Ellen come on in.
Please,
Ellen, you've heard and Steve. You introduced us. Give me your sort of reflection on this, but actually maybe first a little more about you. Like where do you come from in this conversation, and then what's that passion that you have there, and then reflection on any of this stuff. And I'll note to anybody out there that if you click on the Miro link, I've been trying to capture all this stuff. Omid, I don't know if you want to call up the whiteboard real quick, but I've got the better swimmers versus changing the direction of the river, the slow rolling problems, and also this kind of from to thing, and how do we honor intentions. Anyone who clicks on that link and has a web browser can come and help me capture Post-its and ideas and stuff. We're trying to capture this as we go. Alan, back to you. That was just me giving you a little time to think about what did he just ask me.
Sure. Well, I'll start by saying that my journey in healthcare started as a health psychologist, working primarily with people who had been diagnosed with cancer. And so I kind of got started in the realm of folks, health had been taken away from them, and was, whether it be physical health or mental health, as a psychologist, and in some cases both. And so having the opportunity and the privilege to work with folks from whom health had been taken and watch them battle mightily to preserve the health they had and regain the health they could, instilled in me a real sense of health as something very sacred, and to observe the ways, as Steve put it so well, that certainly modern American culture, I think, does push a current against us when it comes to health. There's a part of me that responds to that with a lot of agitation and a lot of anger, and I think we need to take up arms and fight back hard, because when someone has health taken from them, just the grace and strength that people show as they work to regain it or work to preserve what they have is formidable, and people do that every day. But there's whether it be the inequity, or just the degree to which we know what's behind some of what pushes those currents against us. We know the financial interests that are behind some of that. We know the capitalism and the greed that's behind some of that, and it's killing us quite literally. So I have a lot of passion related to putting health within equal reach of everyone and making health accessible and making health affordable. And so, that's kind of what my come from is on all of this. And I think that as I look at the great, from two statements that Steve's Medium article laid out, which I think are just brilliant. I'll say that a couple of them really stand out to me, but certainly the one at the end. And Steve, I don't know if it was intentional as that one is like the foundational one, but making health a value. And I think that word value is important because, you know, do we value taking the time that we need to sleep, to eat, to move, and to connect? Just those four things. And I would argue, and I think you're arguing here, we don't attach near enough value to that. Most of us in our daily lives aren't probably particularly incentivized to even, you know, it may be an act of courage to even say, I value those things, and I'm going to architect my life in a way that reflects I value those things, even if it means I have to, and those things take time. You know, as we've talked before, I'm really kind of obsessed with the degree to which time as a concept is so front and center here, because it takes time to sleep. It takes time to move, to prepare food, to connect with others. And so much of how we live our lives, and to some extent, a role that technology plays, it's to engineer time out of every equation, or to minimize the time requirements of everything we do. And I think sometimes that's been to our great detriment, that there's a reciprocity that we can sort of play out through the commitment of time to things as a way to express the degree to which we value them. And that's another thing, you know, when health is taken away from someone, and I think the pandemic has put all of this in stark relief for all of, you know, how do we get back to thinking about the things that we value and the time that we have left to enjoy them and to participate in them? And why do we feel threatened by something like a virus that could be life-threatening? Well, because it would take time. It would take our time away, the time that we have to be with the people who we love, to do the things that we feel passionate about. And so I think we need to, you know, acknowledge that health takes time. There are certainly ways that technology and other things can help health be easier, and to maybe help health take less time, but that we need to value and stand front and center and say, you know, it takes time, and that's time I'm willing to commit, and that I feel like I live within a culture, whether it's my microculture of my own internal self and well-being, or the culture of my family, the culture of my employer, the culture of my community, that time is important to take in the service of health and well-being.
Ellen, to help us distinguish kind of that state in which people relate to time and the time for health differently, is this a uniquely American thing? Like, do other cultures get this right? Is it a class thing? Like, if you have more money, you could do yoga? Or is this just an acceleration thing? So if we live in a Western world where there's 24/7 media, like, just a lot of cultures have just gotten pulled into kind of an extreme thing. I'm just trying to understand, like, the field on the ground of this kind of problem.
Well, that's a great question. You know, I've never lived outside of the US, so it's easy for me to imagine that there are other cultures where time for health is maybe more valued than in ours. I can say I don't witness it to be a particularly flourishing American value, but I think that you know, and it certainly is a value, or it's a luxury, right? It's a place where equity looms really large. People who have more resources, whether that be more financial resources, more social resources, right? You know, one of the things we buy, if we can, is time. And so it's a place where inequity looms really large as well.
Yeah, this is, by the way, Mickey, if you think about how this connects up to the last two shows, when we talked about flourishing cities, and how the last two shows we focused on was how can the built environment, the spec for cities, kind of the way that we instrument things, pull for kind of solving these kinds of problems. And Steve, what you presented earlier, your 6 points, in a way, is a strategy for that kind of stuff. And what you're, and Ellen, what you're pointing out now is just the really the degree to which our environment makes that difficult. Even like here I am home with COVID, so you'd think I have nothing but time. Still, making the time to get on the treadmill or do the mindfulness thing, it's just amazing how we are about time, right? So I'm meditating on that right now.
But I also think, Ting, who's been on a few times, I mentioned, she splits her time between her family in a village in China and Duke University, and with the shelter in place, she's been doing lots of kind of mini experiments with her and her husband, who's also a behavioral scientist, JW. Kind of how do they decide when they should not have that argument? They realize that they have running on no sleep, and they like put Post-its around their house saying like, if you haven't had that much sleep, don't take anything we say to each other seriously, and whatever. But she says what she sees in China, I know it's a fascinating. I mean, that's got to be a fascinating world there. And I've met both of them, and JW is fascinating too, just as a thinker and polymath. But I would say that she said what the Asian cities, what cities in China are very nervous about, what business leaders and what government leaders are very nervous about, is that the culture is so persuasive. The middle class culture, the middle class market, American, everybody's seen that Hollywood movie. Everybody wants to binge on that thing. Even the rise of Kentucky Fried Chicken, right, which is the biggest chain of fast food in China, right, with variations. They think that they're actually going to have, and they're already seeing early indicators of a spike in weight gain, diabetes, and other things as they get a middle class. And they're really interested in how do they think about their street corners, their neighborhoods differently. One thesis and experiment that she's potentially going to be doing in the next year or two is going to be a Twin Cities effort, where one cardiovascular hospital health initiative is in the middle, and one city just goes about their one neighborhood goes about their normal lives. The other one signs up to kind of new habits, new ways of doing things, and maybe even the place itself is a little more curious and interesting to navigate externally and things like that. And being able to do kind of almost a controlled trial, which is scary in one way. It will happen in China, but also you get the sense that this may be something that we're infecting the world with. This time. Well, time is money. Time, whatever. We have a lot of things that say the opposite of what you just said, Ellen. As a business value, how could we hack that quicker? How could we make a product get there quicker? How could we whatever? I wonder. Well, Ellen, I know you want to say something, but I want to also pose a question to you, which is, when you were working and when you work with people who have cancer, people who have had health taken away from them, what does time turn into for them? Like, what do you see in terms of their perspective on time or their family's perspective on time? What happens?
Well, I would say, sort of surprisingly, if someone's in a life-limiting situation with cancer, time has a way of elongating for a while, right? It's because you're more in the present moment, and you're more focused on and just with that which is in every now, and so you're sort of living in the sort of infinite now in every moment, and not necessarily thinking so far ahead to, the future and the past, right, are both an illusion, or sort of a memory and a dream. But so when you're really in the now, I think for any of us, and this is what I've observed for lots of people who are in life-limiting situations, like the now elongates the sense of time. I think even it reminds me of what I've heard lots of people say during the pandemic. What's the saying? Like the days are long and the weeks are short, or it does kind of change the sense of time people have. And I think that it makes people feel like they have more time because they're really in the moment, which is related to what I wanted to say after, as you were talking about the outsourcing of fast food to other countries, which we know in many, there's clear evidence that outsourcing American fast food to other countries shows a rising in obesity in those countries, on a path that is, sort of a decade or so kind of behind us. And one of the questions that begs, though, I mean, is what are people getting from the immediate gratification of salty, sugary food or another show on. What are we getting from that we aren't getting from something that doesn't have this secondary effect of being harmful, right? And I would argue that, I mean, I can't sit here and say I don't ever eat fast food, or I don't love ice cream, or I don't love to binge on Netflix. But when that becomes so present in our lives that we sort of incur all of these negative effects, it begs the question, what do you not have to give you pleasure, to give you comfort, to give you happiness, that you're using these things instead of? And that, I think, is related to the underlying epidemic of lack of connection and loneliness that we know exists not only, I think, in America, but kind of all over. And again, I would argue part of that is because we don't put time in to connecting with others in an authentic way. And we don't yet really consistently use connectivity to promote connection, which is, I mean, and in some cases we do, there's lots of examples, but clearly there are ways of using connectivity to promote connection that we should deepen and continue to perpetuate, because I think that some of what's going on there is we don't have an underlying fabric of connection to others. So we engage in behaviors that are immediately gratifying, but ultimately not very healthy. And that's a big problem.
It's a giant challenge. What I liked about, maybe, Steve, your framing was this needs to be massive parallel innovation, but with a common set of goals, values, something. And I think that was the interesting idea, right? Which is why maybe I called it a movement. Maybe you don't think of it as a movement, but this notion of having that shared set of values is one way that it changes the way we all look at something if we all kind of reinforce that. And I'm curious about, you mentioned a few things that you're doing at Building H explicitly, like about celebrating people who or highlighting early pioneers doing this stuff, et cetera, et cetera. And I'd love us to talk about that a little bit too. And maybe, Ellen, from your standpoint, what do you see within a big payer provider that, obviously they're healthcare, and there could be good movements here. It's just what are you seeing at a population level that maybe gives you a little hope, or helps you kind of feel like there's a path?
Yeah, I think it's interesting. One of the things that I felt is important is to, at least for now, take a positive framing to this, and sort of an opportunity frame as opposed to sort of a shame frame. Because what I think is that we have all of these industries that have gotten exceptionally good at creating products that sort of meet the needs of their customers, that are sort of associated with those industries. I mean, again, television is extraordinarily good right now. I mean, it's, there is no end of fantastic stuff to watch. They have nailed that job. Automobiles are getting better and better. There was a study I saw co-wind of recently that said I think it was that Tesla drivers who use autopilot spend more time in the car, than those who don't. And so, there are all these examples, I think, they talk about the bliss point in food, of sort of engineering the food to the point that, it's craved by people. And none of them had the job to make us healthier. I mean, they didn't sign up for that. That wasn't a responsibility that was understood, by all of those industries. And I think what we've just seen is that they've each done their job so well, but unfortunately they've all had the same kind of negative consequences, or rather I should say, each of the negative consequences that they've had, the unintended consequences, have sort of lined up in kind of unhealthy directions, whether it means we get less sleep or eat worse or are less active and less social. And I think there's sort of a parallel to kind of what we've done with the planet, and sort of climate change and a number of other environmental things, where we sort of developed a system where everybody did what their job was really well. And then we sort of looked around and said, oh my God, there are these consequences, that we haven't sort of factored into the way we manage economics. And I think there's a parallel here. And so part of it is saying there may be really good opportunities to turn the ingenuity and the creativity and the sort of can-do spirit that I think has characterized so much of American industry, and point it in a somewhat different direction. So I really do want to celebrate the companies that are building things that sort of do make it easier for people to be healthy. One of the ones I love to talk about is Niantic, the company that built Pokemon Go. Because it's a great example of pulling behaviors. It's saying this is a new form of entertainment that gets people outdoors and it gets them moving around, gets them doing it with friends.
I mean, a common theme in what you're describing is that if you want to see a change here, there's hope that in this case, there can be a market response, right? Whether it's Pokemon Go or better products, what you're suggesting is there can be an alignment of clever company work, what's in our interest to delight us, because we're delighted by Pokemon Go and we like being outside and it's healthier. We're even becoming more delighted by cooking at home because with the pandemic, people are experimenting with things. So what was going through my mind as we were talking earlier is, what's the theory of change? Because you're describing a movement. Clearly, this doesn't come from Zeke Emanuel in the White House, and this does not come from the mayor. And it has to come from ourselves. But if something comes from ourselves, what leads it? And you're suggesting that it's a movement in the sense of the environmental movement. But unlike trying to get 100 nations to do something that they're grumpy about, we should all be delighted about feeling.
I think there are two parts. Well, actually, one is I did a piece a couple of years ago, that talked about sort of a starter set of behaviors to shoot for, and they were sort of things like helping people cook dinner for their families or their friends. It was just building more movement into the day, not exercise, not more workouts, but just more movement. It was about getting outdoors. It was about getting better sleep. It was about social connection and building real relationships. And the funny thing about those 5 behaviors is it's not like people hate to do them. They're actually all pretty delightful at some level. It's just that we're often seduced by competitive alternatives.
Well, I do think I think in my own experiences, and I come at it as a dyed-in-the-wool maker, and if I can help it, I try to make something before I know what the hell I'm making, right? So it's sort of make and then go figure out why the hell you made it, or make something to get a rise out of people, not make something because it's perfect. It's like make it so somebody can tear it apart. And one of the things I've noticed, and I don't do it very often, but is sort of these impossible workshops, right? Which is, let's get together for the weekend and do something impossible. And it's something that you can't, it's not a maker workshop where you make like a nice jewelry box for your mom's day or something like that. But it's actually like, no, let's do something impossible. Like, let's make action figures that are 12 inches tall in a box with all the labeling, with the origin story, whatever. And it looks like, born in the backseat of a Eldorado in 1965, made whatever, but of real people in our lives that are heroes. And it's just fun making, and we've hosted a bunch of these, and I'm currently scheming one that's a sort of distributed remote one about making little mechanical automata. It's just toothpicks and foam core and cardboard where you turn the crank and it unfolds almost like a scene from COVID. Like what would your scene about social distancing be or whatever. But what I think is different is that's very different than us binge watching together, or even just together. A few of us are going to watch Aspen Ideas this weekend starting Sunday because it's free to the world, and it's a few hours every night. That's different because you're having a shared experience of a speaker. You can have a sidebar conversation or a movie or a TV series, the Netflix together stuff. But it's very different when you're like, what's she doing over there? Oh man, she just cut the hair off a Barbie doll and used a marker to change it so it looks like a beard for like her husband or her dad or whatever, or the school teacher. Oh my God, that's a great idea. And you end up learning about people through making in a very simple way. And I mentioned I used to be a fellow at Autodesk, and we had something called Instructables, and it's like 20 million people or something a month socially creating tutorials about everything from making something from Halloween to building a log cabin to building a cellular automata. You can find those, to cooking together. And you can actually, as the journey, you can read about the hero's journey in their commenting as they build a tutorial. It's actually a journey. So how do we make together? And I love that idea. Ellen, we're coming up on 5 o'clock. We never stop on time, so that's okay. But you mentioned grace and strength, and I don't know that we talk about that enough. And I almost wanted to pull back on that because just so there's something really magic about what you've seen and noticed as a psychiatrist and kind of helping. Am I getting that word right? And helping with people, psychologist. Sorry, and I knew I was getting it wrong. And helping with people and their family and caregivers who are going through this. What is the positive spin or the positive side of this? Like Steve pointed out, but for humans, like the ability for humans to have grace or strength or whatever. Like, are we discounting how good humans could be? Are we not even giving people the benefit of what could come from the struggle?
We shouldn't, right? So I'm a huge fan of, one of my kind of core guiding principles is grit and grace. I think together, both of them are, and I mean those words in lots of different ways, but I'm a big proponent of just hard work and discipline and persistence. And I think that's neat. I mean, I look at someone like Steve, who I admire so much. You've been at this for so long, and flying the flag and giving these messages and figuring different ways out to come at it. I think that's the grit part. And then the grace is just to recognize the beauty in the human element, whether it's vulnerability or human connection, and the degree to which humans can and do, as terrible as we can be and as sort of wretched and shocking as part of what we see happening in the world today can be, that the world is really full of good, and we love one another, we care for one another, and we can love and care for ourselves in ways that are amazing. One really, there are lots of things I'm hopeful about. And as one example, I'm a member of a professional society called the Society of Behavioral Medicine. And our motto is better health through behavior change. We're a group of about 2,500 health professionals, mostly working on different angles of this problem. And a couple of years ago, we had an organization come to our annual meeting called Girl Trek. And if you don't know about Girl Trek, it's an incredible organization that has definitely used connectivity to promote connection, but they form walking groups of African American women. And it's rooted in the idea that these people's ancestors walked to freedom. And now you're walking again to escape the trappings of poor health that disproportionately affect African American men and women. And so these walking groups form, they create connection. These women walk to healthier lives. And there's just so much meaning at every level of it. And it maybe some of them go on to train for marathons, but that's not the point. It's just to be together, to walk, and to have an experience of shared connection in the service of health in recognition of a history that is just so powerful. And there are other examples of things like that, but Girl Trek really stands out to me. And I think at UPMC, a couple of the things that I feel really hopeful about and good about is that from the get-go, our CEO, who has a background in behavioral health, has said physical and behavioral health cannot be disentangled. And we can't address physical health if we aren't addressing behavioral health, and we need to keep both front and center as we go about trying to help people live healthier lives. And also, a big topic in the last several years, and Karen DeSalvo, who now is the Chief Health Officer at Google, has written a lot about this. Health systems have to take some responsibility for jumping in and addressing the social determinants of health, which are a lot of what some of the current running against us, where those come from, problems related to equity. And the UPMC Center for Social Impact is taking those head on, as are other healthcare systems who have said, we have to take some responsibility for addressing these problems. So, and those are, again, like, whether it be addressing behavioral health, addressing social determinants, equity, all examples of how we truly can find the best in one another. And this is what you've showcased on Quarantine, from the beginning, where amid a global pandemic, humans are good at making and at figuring things. We've been pretty good at wrecking things, but we're also quite good at figuring out where to find cracks to push ourselves through, where the light's coming in, and just really kind of expand that. And, I think Building H is doing that. We're doing that in health. We're doing that in the service of population health. And it all really, I think, at the end of the day, comes back to connecting with a sense of, shared humanity and just love for one another. That if we root ourselves in that, we can do amazing things.
Earlier at the very top of the hour, when Mickey said we were entering season 2 of Quarantine, which was artificial, but what distinguished the two was season 1 was kind of the phenomenological report of what the heck was going on. And season 2 was kind of like, how do we all align to build a better world? Or how does this audience and other communities come together and intentionally create? Because there's some co-creation role for everybody, right? So what we're discussing, Steve, is partly what companies do, but it's partly what teams of people can do in any city by forming some club, whether it's in Kampala or here. And, in this thing that we were talking about last week, Audacities, which is coming up with a challenge to fund new projects. So one interesting place to end up is, because a lot of our audience is an innovation community and our people in cities. Okay, it's a few years from now, either what are some of the things that got done, or what are some of the challenges that people should organize and together go do? Because I think the future of both what we're doing as a show, but as, by the way, with all this time, people are going to spend still sheltering and students at home, and be a lot of cognitive surplus for the next year or so. What are some things we can go to work on here?
Yeah.
Let me think of a few. So some I think are fairly obvious, like transportation. There's a ton of innovation going on in transportation in lots of different modes of transportation, and I think there are just decisions to make about getting that right in terms of enabling kind of alternative forms, alternative to drive one person driving my big vehicle into the city every day, kinds of modes. So I think and I think one of the interesting areas there is sort of the experience layer. Obviously you need infrastructure, obviously you need, sort of policies. But I think, there's nothing easier than tapping a phone 3 times and having an Uber show up. But what if actually, a mixed mode transportation, a trip had an experience that was just as easy. I think there's some creativity that can be applied there. I think the making dinner challenge is a great one. I think it's a fun one. There's a lot that can be done there. I think one of the things, just in sleep, I think there are plenty of apps that tell us to sleep more and remind us to go to sleep. I want to see apps that help us go to sleep. I want to see, when your thermostat and your you can do stuff with noise and light and even sort of your entertainment media are all conspiring to help you go to sleep when you want to go to sleep. I think that would be an interesting technical challenge.
I like this idea of conspiring to help you go to sleep. And it goes back to everything's an accessory to everything else. Like, we know that loneliness and having people who kind of cook get you cooking. Having people who kind of feel like going for a walk get you walking. We know those things. Yeah. What if the products were trying to do that too? I recently saw at Eureka Park, which is the weird, sponsored by the National Institutes of Health, underground layer of consumer electronics show. About a year now, probably almost 2 years now. I say recently because it all, physical worlds have all faded. But what was really interesting was they had a study from these are little tabletop demonstrations that you never know if they'll turn into a product or a company someday. But in Eureka Park, there was a demonstration from some sleep researchers at a university that actually waking people up who have insomnia just as they go to sleep, and they just basically buzzed your arm, like basically just as you went to sleep. They ended up extending your sleep dramatically and getting rid of insomnia because of some weird way your body works. Your body just is not, it's not linear, it's not obvious, it's a weird thing. But it turned out that every time you almost fell asleep as an insomniac, if they woke you up for a second, in the course of about 2 weeks, you had an 8-hour sleep and you had
That's
trained
crazy.
yourself to have an 8-hour sleep. So there are weird things that are nonsensical, but it's almost like if we were to focus in on your 5 dimensions or your 5 levers, levers to change, right? Which I think is an interesting system way of thinking about this. And force yourself as a product designer, as a building designer, as somebody who's trying to think about policies. Okay, how could we do that move from A to B? What would it look like? What would it look like at scale? Because the other thing we've gotten very good at is just apparently make something and then scale it to a few billion people.
Well,
what would it look like if we did that?
Yeah, I mean, one of the interesting announcements. I think one of the interesting announcements that came from Apple was it yesterday, the day before,
Monday,
was actually that
this is blurry
really
days, Steve. It's just blurry.
Yeah, exactly. Yeah. Somebody showed me a tweet the other day. It's like a Twitter handle that tells you what day it is, which is like a really valuable service. Apple announced that they're sort of really dramatically expanding their bike directions, in Apple Maps.
Yeah.
And that sounds like a really little thing, but I think it's actually really positive because, again, if the default on something like Apple Maps or Google Maps is that it's really all about driving and any other mode is sort of second class and secondary, there's a cultural norming that goes with that. There's just the simple experience that if you make something a little harder or a little easier, you're going to get shifts in behavior. But there's also sort of the idea that like, wait, maybe that's just now considered normal, and so I think that
in
kind of
design, this notion of changing the defaults, right? So there's a classic study in human-centered design that like in the backseat entertainment things back in the day when they were in the backseat of airplanes, when we flew airplanes, if you remember that era, in the backseat, the idea was, give the person who doesn't understand how that backseat navigation, like help them first. Because the geeky kid or the weekend warrior, the whatever, they'll find the game 6 layers down in the thing. You don't need to worry about them. But how do you change the defaults? How do you kind of tilt that way? And the paternalism thing, I think is a valid point, which is about honoring intentions. The work that I've been doing personally is around goal-directed and generative learning, which is about how do we use sort of dynamic formative assessment, but striving towards successively approximating goals, where it's n equals 1. I own the goals. But the machine learning systems, the tool systems are going, whoa, you're like so close to leveling up. Like you almost did it, but it's your goal. It's not some third party's goal. And I think this notion of n equals 1, because it's kind of trivial now to actually have something for us. The problem is today that's just n equal 1 for eyeball marketing. It's not, it's I'm not saying only, but we have very large business systems that are based on, if I can track you for the next 32 seconds and keep showing you those shoes, the retargeting market is an example. But what if we could say, you choose the goals, you choose the daily, weekly, monthly, yearly goals, maybe seed some of those goals to somebody you love and look at things. And then how do we successfully approximate them? How do we find out, because in the act of even goal-directed design, which we rolled out a few years ago at Autodesk, which was really fascinating to watch, people thought it was curation. The architects would set goals and then the machines would go find them, and you'd just be a good curator of looking at pretty pictures. What they said was it was kind of like jazz. If they adjusted the goal and then they watched the algorithm do it, the algorithm would like do stuff because it has no common sense. It would do crazy things. And they'd be like, no, that's what would happen if I reached those goals. That would be a bad thing. Let me adjust the goals. And it caused them to change their goals over time from the feedback loop, because they were able to have some closed loop. And so much of this stuff just doesn't feel closed loop at all. It feels very open-ended and slow-moving disasters and things like that. So anyway, I don't want to. I think there are some really interesting.
You're making me think.
We are at 5:13 quarantine, Peter. How would you like to close?
I think before we leave, we need to have a serious conversation about changing defaults. About changing our defaults. If I could direct everyone's attention, both yours and the audience's, to the lower right-hand part of the screen, it says, "Stay home, save lives." And it seems to me we may be at the point of changing the default. I don't know if it's go out, wear masks, go out, get on your bike and wear masks. But since we have official medical professionals here that are trying to change our environment and get us to be healthier. Perhaps we could collaborate on what's next, because it occurs to me that that bug is due for an update, but it has to be a safe behavioral update. So I'd love your thoughts on it, because that should be the default of how we're spending the coming weeks.
I'm going to take a drink of wine, which is not a good thing, I guess, sometimes, but I need it right now.
You know, I would actually sort of, this is where I would say, when it comes to something like this, I'm not the expert, and you probably don't want my advice on that. I mean, I have my own thoughts about it. Ellen, you at least work for a hospital system. So,
I think it's early to say that stay home, save lives is the default. I think we're still pushing that as the alternative, and the default for many is still go out, have fun, and that we have to keep really vigilant as we observe from an epidemiological perspective the degree to which this virus is wickedly contagious. We're still learning about it. I mean, I think it's been incredible to observe a population level behavior change, like staying home and wearing masks. And, I think a lot of that has to do with, you think, and I wrote something a few weeks ago about this, where, boy, we struggle to get people to change behavior so mightily. Here we changed whole populations of behavior, like that. But the threat of the risk, the consequence of not adhering to the recommended behavior is pretty swift and pretty severe. And we're talking about a relatively limited set of behaviors. Stay home, wear a mask. If you're trying to lose weight, that's an extremely complicated set of a string of behaviors that have a distal benefit, right? And maybe not even an avoided risky consequence. So the calculus of the behavior around stay home, save lives is a lot easier in this case. And I think that, that boy, people are sacrificing mightily to do that across the board, but that we actually need to keep pushing against our, I just said to a family member today, I said, well, maybe we'll come visit next weekend. And I thought, I just completely forgot about the pandemic for a moment. And I enjoyed it while I forgot about it. But I think it's too soon to go back to our default. I think we have to be really vigilant.
I mean, on some level, what's happening right now is a huge natural experiment, isn't it? Because you had a lot of people out in the Floyd protest with masks. You've got the Trump rallies indoors without masks. You've got outdoor dining here in San Francisco. I guess people aren't really wearing masks because they're eating. Is there a way that all of this data rolls up and we can start discerning out of this what works and what doesn't work? Or are we all just going to have to watch things get worse and then adjust?
So I think we can be data driven in our guidance. And I think there's variability largely at the state level to the degree to which people are doing that. But, my money's on the epidemiologists. I think that we look to the epidemiology leaders to give us guidance on how to, it's a tricky time delay, right? I mean, we got this 2-week delay between, and so that's a tricky thing for the human mind to comprehend. But I think that we just have to watch the data, use all the amazing data visualizations. There's so much good open science and shared work that's happening in the scientific community around this, and keep leaning into that hard. It absolutely is an amazing natural experiment, but one, I think that there's so much to be salvaged from around how people can work together and use their own behavior as a way to protect themselves and others. We're getting a lot of practice at that, and a lot of modeling, and a lot of seeing what happens when we're able to do that, and that can extend across so many things beyond just containing a pandemic.
I think there are two things that have made this especially difficult, and it is the symptomless transmission. So you could feel fine and you could be contagious. And the sort of the notion, and again, I think the science is not 100% on this, but the general direction that the mask protects, the mask does less to protect the wearer than it does to protect those who are around the wearer. So it's your good act that saves others, as opposed to you're looking out for yourself. And I think those two things, sort of mess with our heads a little bit and make it harder. If you feel fine, you think, I'm not contagious, I'm not going to hurt
It is interesting though that idea flipped in a very short period of time. There was that researcher who put out how to sew your own masks. What happened in this country where they just decided to all make masks? Everybody can make a mask. It's not a big deal.
Yeah.
And very quickly, because people got kind of funny and clever about, okay, really rude and silly things like, let's say that you don't have pants on and you pee on somebody.
Yeah.
Turns out you're probably gonna hit them. But if you have pants on, you're probably just gonna make yourself a big mess. There were lots of different kind of metaphors and examples and things like that. And I think what happened is the people that started doing it, like I remember we were sitting here sewing masks, and it was it's not a big deal. Was that you kind of felt, because it flipped to it's about protecting people around you, not you. That when you went outside, the minute you saw somebody, you actually did something good for them. So it was actually this communal thing. You're like, I'm going to walk on the other side of the street, or I'm pulling on my mask. You're getting close, and it actually was not about me. It was about us. Yeah. And I do think that was a really subtle, beautiful, very fast flip, not obviously everywhere, depending on, I guess, the television station you watch and the frame that you subscribe to, but generally I think most people figured it out in many places.
And I think the experience is different. I mean, I think the experience of someone who has lost a person close to them through this, or has known people who have suffered from it, versus somebody who maybe is in a town where there are 3 degrees of separation from anybody that may have experienced it, and they look around and everybody seems fine. It's just, I think it's hard. Everybody's experience has been different, and I think their attitudes are colored by those experiences. Understandable.
The whole communications environment with the conspiracy theories and the invention, and it's a final, because we're going to wrap, but just this is fascinating. By the way, even the way we're behaving is indicative of how this whole
we may never end, right? This might be a episode. I hope you're okay. We'll walk for the next segment. We'll just all pick up.
And then we got really interested in other stuff and change. And part of what you brought us back to, Ellen, is this is a real serious thing that's going on here. Do you guys have any final thoughts on why so many people make up weird fantasies and conspiracy theories and all that? Because there's something like I don't know if it's just the political environment we're in, or a relationship to science, or they don't like staying indoors, but there is a factor in here that just seems odd in the public health realm.
Well,
it's so hard. I don't know if we'd want to demonize people. I think the reality is, if you surround me with a bunch of stories in one direction, I'm going to believe it.
What?
I think if you surround me with a bunch of stories in one direction, I'm going to believe it. Like, the environment shapes us.
Well, one thing that I observed a lot during my time working with people who've been diagnosed with cancer is one thing that cancer does is it kind of strips away a buffer that most of us have against uncertainty. So we all think that we're going to end this podcast and maybe go downstairs and have a glass of wine, and we're going to wake up tomorrow, and we don't know that's going to happen. Life is fraught with uncertainty, and when you're diagnosed with a life-limiting illness, you get that buffer that most of us live with stripped away. So I think there's a lot of ways to answer the question that you asked, but one thing that came to mind for me is most humans don't like uncertainty, and we will try to fill a vacuum with something that gives us a semblance of, okay, we know what's going on, even if it's to our detriment or inaccurate or even hurtful to ourselves. But the truth is that, life is uncertain, and there's a magic to that, right? And if you can move into the magic of the not knowing and try to find your way through that, which I think leads to a ton of innovation, a ton of making. But there's a tolerance for that not knowing that maybe many of us have grown in that tolerance during this pandemic, because it turns out that none of us knew this was going to happen, right? And so, but people don't like uncertainty, and they'll fill those vacuums however they can.
Yeah,
that's good.
Thank you. This was completely enlightening, and you're making these I didn't have a chance to know that much ahead of time. So I was at rapt attention. I was leaning in more than usual, both because this is the talk about a great challenge for the human race to go work on. B, kind of putting it in the context of this world in which we live. And Mick, this has given us something to think about, because Friday's show was supposed to be about San Francisco opening up, and we had told the planning department we would come live from outdoor restaurants where people are outdoor and we can have masks on. Although maybe we shouldn't be promoting that, so we got to go figure that one out before Friday.
Yeah. Well, it is interesting. We had Robin on from the urban planning part of of San Francisco, the mayor's office, and about a week or two ago, and he said, we're looking for proposals from small businesses of how you would use the streets, the sidewalks, the parks, and we will fast track them. Like, write a 2-page proposal and we'll give you access, because we happen to have the parks, the streets, and the things. If because they really do want to. I think they've been very consistent about distancing and things, but they're like, hey, this is our city. What do you want to do with it? Do you should use the street? We'll close it off. Use the park down at the end of your block if you can deliver and keep your business running. And I do think that there's a positive element there, which is just saying, wait, relax those constraints for a second. We never thought we could use like a parking place as a micro park. Could we? But yeah, you could.
And if you walk through North Beach now, it looks more like Venice, Italy, with everybody outside and like nobody inside. And a fair amount of masks, but it's an experiment, right? The city wants to open up and try something, and it's beautiful, and people love being outside and how to stay safe.
Thank you so much, Steve, and thank you so much, Ellen.
Real pleasure. Thanks so much for having me.
Just a fun conversation. Yeah.
Thanks to all of you.
Thank you for sharing.
Thanks, Mick. Thank you, Omid, Mohib.
Thank you, Omid. Mohib, if you're there, I don't know if he was he also in here somewhere?
Maybe.
All the people who've helped us. Jocelyn, I think, our new intern, is helping, kind of trying to track this and pull it together. So great volunteer army, and thank you, everybody.
Thanks, folks. It is now 5:26 Pacific Quarantine, and the network needs this circuit back because there's reruns of Dr. Kildare coming up. So we will see you all we will see you on Friday. Thank you very much, and go out, but not too much, and with a mask. And come home and do some yoga. Bye. Take care.
Cook something. Yeah.
Let's get close, but not so close. Quarantine. You can share from a distance. Quarantine. We want to see each other. You'll have to stay in your quarantine space while we talk.